there is certainly more and more evidence compounding on what is happening to our kids related to this pandemic. And when you look at mental health visitations to hospitals, all the data now is showing that in 2020, you saw 25 to 30% increases with young children and children year over year from 19. When we look at the fact that we know we're not, even though our educators are doing everything humanly possible with these hybrid schedules, we know our kids are not doing as well. And we also know we have serious problems with addiction, with opioids, suicide right now, and this is all pandemic driven. So what we've done in this whole process is we've always based decisions on data, not political pressure. There's a lot of political pressure related to schools, whether it's parents advocating for opening or some groups concerned about opening. So it's important we find our balance as a community. In the beginning of this process, when we went back to school, school districts had the opportunity to develop plans and to get feedback from all the stakeholders. The stakeholders being the workforce, the parents, and giving the parents options for in-person learning or remote learning. They developed plans based off of the facts on the ground at that time. Here we are on the backside of the pandemic, and things have changed. The facts on the ground have changed. We know more about the virus. Specifically, we know more with our testing data about transmission, when it's, how it happens. In addition to that, we have vaccinated 28% of the adult population right now. That if you broke down, I don't even know the eligible population, but that percentage would be much, much higher. So when we take all these factors in, we were approached by school districts about looking at the 6 feet to something less than 6 feet for physical distancing. The reason that is because based off of their plans originally, they could have did something less than 6 feet, but they didn't. And why they didn't for most cases was back when these plans were developed, the thought process was that children would not wear masks because it would be a change, it would be difficult. What we now know is that children are very good at wearing masks. And so the districts put into their plans desks 6 feet apart. Because if you, at the time, if you were 6 feet apart, the child did not have to wear a mask. We changed that later on, and we worked with districts to make sure all the kids were wearing masks. So we were asked to look at this, to reevaluate it. What we have reevaluated. Dr. Gupta and her team spent a lot of time looking at this specific issue based off of the facts on the ground. What we have come up with is guidance. The final decision of how to implement the guidance, or if you implement the guidance, will be the school districts. But at this time, Dr. Gupta, and I'll have her come up in a minute to give more background, but at this time, Dr. Gupta has recommended to me, and I feel confident in her recommendation, that it is okay to go from 6 feet to something less than 6 feet if there is a physical barrier. So if you have some sort of partition. So recognizing that the partition is something that will have a cost to it, the county will pay for the partitions for any district that needs them. We know that some districts already have them. We'll take an inventory if folks, after reviewing the guidance, think they want to go to something different than their existing plan. How many partitions would they need? We'll pay for it. So that's not a barrier to modifying their plans. I'll ask that Dr. Gupta comes up and goes through everything, but certainly we still want to see testing programs in the schools. We want to analyze the data. Everything is fluid. We certainly reserve the right to encourage the districts to work with us if things change to adapt, whether that's either way, if things get better or things get worse. But again, this will be a school district decision. We are giving guidance based off of the data and on the ground here in our county, in our buildings at this moment in time.